Hello friends, in today's episode we'll be talking about HSG, hysterosalpingography. In exam you generally get film of HSG. So you will say that this is an HSG film, hysterosalpingographic film showing the Leach-Wilkinson's cannula with the dye that is in the vagina, the cervix and the uterus. The uterine cavity is properly delineated. Both the tubes are delineated. You can see this is the right tube and this is the right side free spill, and this is the left tube. Can you recognize this is the left tube and it has gone there, and this is right sided spill. So this HSG shows the film of a normal patient with bilateral tubes patent. So this patient is a case of infertility. Generally in evaluation of infertility we get HSG done. This HSG shows whether bilateral tubes are patent or not. Now let us check the second film which you get in examination. Now this film you will again say this is an HSG film showing the Leach-Wilkinson's cannula, the vaginal canal, the cervix and the uterus. Now uterine cavity is also well delineated. In the left side, this is the left side. See, this is the right R written and this is the left side. So left side the tube is patent and there is spill in the left side. But in the right side no tube and no peritoneal spill is visible. So there is left sided cornual block at the level of the cornu. Now you will be asked in examination how the management of this patient will be. So you should say that if there is one-sided patency present, then patient can go for normal conception or patient can go for intrauterine insemination as per the protocols. But if bilateral tubes were blocked in this patient, sometimes patient comes with bilateral blockage of the tubes, then in that case you will say that patient might have cornual spasm leading to tubal blockage. So we will ask the patient to go for diagnostic hysteroscopy and laparoscopy in OT under general anesthesia. So in diagnostic hysteroscopy and laparoscopy we will try to put dye, methylene blue dye inside and check whether the tubes are patent, because most of the times due to pain patient might have cornual spasm and tubes might get blocked. Now let us check the third film which you will get in examination. Now this HSG film is also showing Leach-Wilkinson's cannula with the uterine cavity, the cervix, the uterine cavity and bilateral tubes. Now in these tubes you can find that the left sided tube is dilated at the end. So this is hydrosalpinx. So there is hydrosalpinx in left side, whereas right sided tube anatomy is also not proper. There is beading of the tube. So beaded tubes, hydrosalpinx, these are markers of tuberculosis. The tuberculous salpingitis is very common, which is a cause of genital tuberculosis and infertility in patients. So this patient will be worked up for infertility. For infertility you get endometrial aspirate taken and that aspirate is sent for CBNAT or AFB, that is acid fast bacilli. Okay, so these tubes are pathological and they are dilated tubes. Now in examination you are asked what are the signs of tuberculous salpingitis. In my next video I will be talking in detail about genital tuberculosis. This film is also showing genital tuberculosis. You see this is an HSG film showing the Leach-Wilkinson's cannula, the uterine cavity and this right sided tube and left sided tube. This is showing the right sided tube. See, it has beading, proper beading present and hydrosalpinx present. The left sided tube also has beading and hydrosalpinx. So this patient is also probably having tuberculosis. Let us see one more HSG film. This also sometimes comes in examination. This HSG film shows the Leach-Wilkinson's cannula. This is how you will tell in exam. The cervix, the uterus. Now this uterine cavity has one space occupying lesion. Now this space occupying lesion can have certain differential diagnosis. There can be air bubble, and there can be submucosal fibroid or polyp. So how do you differentiate? In subsequent films, if you find the lesion changing its position, then it will be an air cavity. If it is in the same position, then it will be a submucosal fibroid or a polyp. There is the left sided tube is easily visible with spill. The right sided tube is also visible and there is spill. So in this case, the problem is in the uterine cavity. So this is how we read an HSG film, and then your viva will go accordingly. So for more information, remain subscribed to our channel Medimantra.